Dr. Wenstrup, you're recognized.
Thank you very much, and thank you all for being here. I've long said, since I've been in Congress, especially on health issues, that we have these hearings, we need to hear from those wearing the white coats, not just the ones writing the white papers. It makes a big difference, the people that are actually treating patients. And you know, we've done a lot, and especially as our Doctors Caucus here, in addressing these issues. You're preaching to the choir with us. It's others we have to convince of things. You know, I'm glad I live in a country with safety nets, but we got to make sure they're working. And you know, in medicine, as you all know, there's the risk of bad luck. No one necessarily knows why they got the glioblastoma. But there's also the risk of bad behavior, and that we can have something to do with. You know, when we talk as a government, here, we talk about success being how many people you'll have enrolled in a program. And you're not checking whether the program's really working or not. Instead of looking at, hey, we've got more people healthy than ever before in America. Wouldn't that be great? You know, our goal, we keep talking about being the healthiest nation on the planet. And we can't do things like in SNAP. Okay, I'm glad we have programs to feed people that can't feed themselves. But what are we feeding them? And you know, they say things like, rather than focusing on calories or nutrition, they focus on calories. And when we say, well, we should restrict it, and these are the foods that people should be able to get in these programs. And the response we get up here, well, rich people get to buy those foods, so that's not fair. Well, life isn't fair, but we're trying to make life better. And so, you know, just talking about obesity, I was doing an interview about a year and a half ago, and it's like, it's terrible. There's such a stigma against obesity. And I said, no, the stigma is against those who want to talk about it. And we're turning that around. That is changing, and it's thanks to all of you and some people here. You know, with the Army, I was teaching a class called the Performance Triad, and it was about sleep, activity, nutrition, right? And we talked about, and it was referenced here, we can keep people alive for a long time in this country, but can we keep them healthy for a long time? And even those with chronic diseases, can we make you as healthy as you possibly can so you can live the best life that you might be able to? So I'm just grateful you're all here, and I just want to share some things. You know, I've said for a long time, I said, yeah, we reward the doctor that does a coronary bypass graft, but not the doctor and the patient that prevent it from ever happening, right? We got to look at those types of things, and that's what really success is. And what are the root causes? You talk about social determinants of health. We had a rural and underserved healthcare task force, because rural and underserved areas, they got the same problems, basically. So, I mean, I had a patient one time, diabetic, end-stage renal disease, neuropathy, trying to prevent him from ulcerating over and over again. And he says to me, I can't come to you anymore because they changed my bus schedule. And I said, well, I'm going to change my schedule then. So you can get in here. Those are things we have to address, you know, at the local level and whatever. And Dr. Ronaldo, I was thinking, we have one of our hospitals, when I went to their free clinic, they also have a food bank with nutritious food there. And so this is what they said, more people show up for their appointments because they know they're going to leave with food. And so we had another really nice FQHC, and a new large food bank was going in next door. I said, build a sidewalk. Well, they did, and they put a gazebo. And I said, so people do that. I said, you know what else you might do in here, though, is have local employers post jobs that they have available. But all of these things are very holistic and rounded. And I do have some good news. When we talk about school, I've always complained we didn't get much on nutrition or vitamins. And you know, I did that study and on my own when I was in med school. But so Xavier University is starting a new DO school, and they're doing it because the DOs tend to gravitate towards primary care, and we need more primary care. And I talked to the new dean about prevention, and I said, and what about nutrition? He showed me his whiteboard that was right behind me, and he has that right in with biochemistry. I said, well, that'll make biochemistry a lot more interesting. So I'm glad that you're doing that. So it is being recognized, and I think we have to keep beating that drum. But you're right. Food as medicine, prescribe, we do that. That's what nutritionists do. That's what dietitians do. This is your prescription for what you need. So I don't have a question for you because you all got it figured out. And I'm out of time, but I only have an undergraduate degree in psychology, but that's one of the root causes too. And I can stay away from ice cream. If I have one bite, there's going to be two. Anyway, I yield back. Thank you.